right now, and also our Jewish community observing the Passover holiday as well. I'd also like to note that the UW acknowledges the Coast Salish people of this land, the land which touches the shared waters of all tribes and bands within the Squamish, Tulalip, and Muckleshoot nations. Today, I'm super grateful to our UW colleagues, Dr. David Takeuchi and Dr. Jane Lee from UW's School of Social Work. We initially found their work when we were looking for UW actions around the Stop Asian Hate movement. And I'm super grateful and thankful to you both for giving us the gift of your time and perspective today. There's been a long history of anti-Asian and Pacific Islander racism in our society. And once again, this combination of embedded racism and recent events have inflamed the problem even more. And we really appreciate these two scholars who have led research into some of the underlying causes and manifestations of this anti-Asian and Pacific Islander racism, and who've been active in actions that support our communities and our friends and neighbors. They're here to welcome a broad discussion as well as to help us think about steps that we can take to support our AAPI family through the hurt and pain. And this is connected in a larger sense, again, to our efforts to start understanding better and overcoming all the underlying causes of racism and colonial Eurocentric constructions of our society. So I'm going to turn it over now to Ayumi Pottinger, who I'm proud to advise as a graduate PhD student, and who's also doing a great job as our inaugural chair of our MolES Student Diversity Committee. And I thank all of the students for their incredible passion and work this year. So Ayumi will talk about the meeting norms and introduce our guests.
Thanks, Pat. So yeah, I'm going to go over some group norms. As attendees, you've accepted the MolES Seminar Code of Conduct, but we just want to reiterate some points. So harassing behavior will result in being kicked from the seminar. Please stay muted unless you're speaking to reduce background noise. You might be able to hear a leaf blower coming from me, so I will mute myself as soon as I'm done talking. We won't have the same ideas, but we will all respect each other. That means listening actively, listening respectfully, even if you disagree, and be respectful of our speakers who are taking time out of their busy schedules to speak with us. Have a teachable attitude. We're allowed to be wrong, but we need to be willing to learn if and when we are. And lastly, we don't need to be perfect to be here. Next, I have the privilege of introducing our speakers. Dr. Jane Lee is an assistant professor with the School of Social Work. Dr. Lee received her bachelor's in Spanish and sociology from the University of Notre Dame, master's in social work from Columbia University, and a PhD in social work from NYU. Dr. Lee's research focuses on reducing health disparities among racial, ethnic, and immigrant populations. She also works with organizations such as the Early Career Faculty Women of Color Working Group, UW's Latino Center for Health, UW's Center for Studies in Demography and Ecology, and the UW Fred Hutch Center for AIDS Research. She is a KL2 scholar at the Institute of Translational Health Sciences, an honoree of the University of Notre Dame Domer Dozen, and has received the NIH National Center for Advancing Translational Sciences Academic and Community Partnership Award, among many other awards. Her career is marked by service and advocacy for vulnerable populations, working as a domestic violence counselor, creating support groups for immigrant women, family counseling, and as a counselor to sexual assault survivors. Dr. David Takeuchi is a sociologist whose research focuses on health and help seeking among racial, ethnic, and immigrant populations. He is the Associate Dean for Faculty Excellence with the School of Social Work and received his bachelor's and PhD in sociology from the University of Hawaii. Dr. Takeuchi received the Legacy Award from the Family Research Consortium, the Innovations Award from the National Centers on Health and Health Disparities, the Leonard Perlin Award from the American Sociological Association, or ASA, as well as the ASA's Distinguished Contributions to the Study of Asian American Communities Award. He's an elected member of the Washington State Academy of Sciences, Sociological Research Association, and the American Academy of Social Work and Social Welfare. Dr. Takeuchi has led a career punctuated by research and advocacy for marginalized groups, studying mental health in minority communities and health disparities in society. This past year, he's been part of the AAPI COVID-19 Needs Assessment Project, which aims to conduct timely, policy-relevant research to assess the needs and impact of the pandemic on Asian American, Native Hawaiian, and Pacific Islander communities. It's truly an honor to introduce these wonderful speakers, and I will pass the mic back to Pat, our moderator.
Thank you, Ayumi, and again to all our students for their hard work in pulling this together on a pretty short timeline, and also our Institute staff, and a call out especially to Corin, who's running the show today and was a lot of help behind the scenes. So before we begin the discussion, I'd like to briefly go over some housekeeping for the event. If you have a question and want to ask it through the Zoom video, then please use the raise hand function, and I will call on you to ask your question. The second option is to, of course, to put your question in the chat, and we'll be pulling questions kind of back and forth between the chat and the live discussion. And I apologize in advance. We'll likely not have time for all of them, but this is just one of our first steps, and we're going to keep going and give everybody a chance over time. If you're not asking a question, we ask that you remain muted with your camera turned off so as to avoid any distractions during the event. And again, this event is being recorded, and the link will be sent out through our Institute network and also the School of Social Work after the event is over. Following the discussion with our guests today, there'll be an optional half-hour moderated by our student committee members on what was discussed and to share any other thoughts. I also want to note that the UW makes available a number of different counseling resources, a number of links to Asian businesses to support and so forth, and Ayumi and Corin have put that into the chat as well. So I'd like to get us started, I guess, by first letting our guests say a few words about themselves and to briefly introduce their research, and then I'll get us started with a kickoff question. So maybe Dr. Lee, could you first start?
Sure, thank you so much, and thank you, Ayumi, for that very generous introduction. As Ayumi mentioned, I am an assistant professor in the School of Social Work, and my research focuses on the role of immigration and related processes in shaping health outcomes among racial, ethnic, minority, and immigrant populations. And much of my work and research in addressing health inequities has really utilized community-centered and community-based participatory approaches. So I really aim to center the voices of racial ethnic minorities and highlight their lived experiences. And in introducing myself, I think it's really important, especially today, to not just highlight my role as a professor and an educator and mentor at the UW, but also to note that I'm a social worker. I identify as a Korean American woman. I'm a daughter of immigrants. I'm also a mother and a sister. And these roles and identities have really been salient these past few weeks. And also just thankful to Dr. Takeuchi, who has been such a mentor to me. So I feel really honored to be here to be speaking with him.
Thank you so much, Jane. And Dr. Takeuchi, please.
Yeah. Thank you, Patrick. And Ayumi, thank you for that introduction. And it's always wonderful to be on a panel with Jane. I think Ayumi's introduction did a fine job of kind of giving my background, so I won't add to that. But I just want to remark on an observation from last week that has relevance to our discussion today. And there was a news item about a Westchester, Ohio Asian American, I think his name was Lee Wong, who may or may not be an elected official, but he has some role in the local government there. And I guess they were having a meeting, and what he did was he stood up and said that he had been a victim of Asian American anti-Asian American sentiment, and it was called different kinds of names. And he stood up and he unbuttoned his shirt and he revealed a number of scars on his body. And he said that the scars came from his service. I think was like what 20-year service in the military. And he remarked that the scars were a reflection of his patriotism, and that why did he have to show his patriotism in this way as a result of anti-Asian sentiment. And I think that's a nice way of framing it, because I think racism not only casts aspersions and can be violent against people, but to make us do things that try to have us prove that we somehow belong in American society. And I think that's the insidious nature of racism that we'll discuss today. And so I think the bottom line for me, one of the messages I would communicate for today's discussion is racism is bad for your health, that it eats at the foundation of our core, because not only is it stressful, but it's stress based on something that we cannot change. It's against our race, something we cannot change. And not only is it harmful to our health, but it's also deadly. It's harmful to our mortality. It can kill. So with that observation, I want to turn it over back to Patrick and kind of see where this discussion goes, and be glad to talk more about different facets of that observation, as well as how we might think about making some systemic changes.
Yeah, I was very touched, David, by that video myself, and that's a nice thing to note here at the beginning, I think, to put this in a personal context. So I'm going to take the moderator's privilege and ask maybe just a first question, which is probably a little too big of a question in a way, but to get us going. But could you talk a little bit about the historical and colonial roots? Because of course this racism does go back as long as our society really goes back, and provide maybe some perspective and how that connects to today's events over this pandemic year and this inflammation and reemergence of this anti-AAPI racism, currently.
I'll let you start, David.
Yeah, one of the things that we may talk about today is what are the kind of images or stereotypes Asian Americans exist. And one of the persistent ones is around being the perpetual foreigner, that is always the outsider, never the integrated one. And I think historically that image has been cemented within the kind of history of Asian American migration into the US, where since the immigration to the US, which came in large numbers during the gold rush in California, with a number of Chinese immigrants coming to participate in that gold rush. And over time, I think that kind of otherness of Asian Americans kind of peaks whenever we have tensions with other kinds of countries, like China in one case, and Japan. You'll see historically the notion of the yellow peril come in. And this came up during World War II when Japanese Americans were interned. The notion that even when Asian Americans are US residents, that this image persists, and it arises in insidious ways whenever there's a conflict or tension with an Asian country. And it doesn't necessarily matter whether the country and that specific ethnicity are linked. So with Japanese tensions with Japan, the tensions can arise with other Asian American groups. There's a classic documentary that I would advise people to watch if they have a chance. It's called Who Killed Vincent Chin? And it arises from a case in 1982, I believe, where Vincent Chin was brutally beaten by two auto workers, white auto workers. And at that time, there were tensions with Japan around different kinds of goods that Japan was sending to the US, especially around cars. So there are tensions in the auto industry. So Vincent Chen, who's not Japanese American, was brutally beaten because of those tensions with Japan. And I think this documentary carries that whole theme around the kinds of conflicts and tensions and how that may affect the way we respond to Asian Americans. So I don't know, Jane, if you want to add something. Or...
Yeah, I think alongside that, you mentioned the stereotype of Asians as the perpetual foreigner. I also think, there's the common stereotype of, towards Asian women as hypersexualized and really objectified. And I think that also stems from policies and from history. You were kind of mentioning the Chinese Exclusion Act, but also the Page Act, and these policies which really presumed Chinese women or Asian women as immoral or prostitutes really, continue to kind of justify some unjust behavior towards Asian women. And you were mentioning Vincent Chin. I think also just the erasure of Asians in curricula and in US history is part of the violence. I remember learning about Vincent Chin and wondering, how come I never heard about these stories or these policies? And I think that's the silence and invisibility of this vast and diverse group is really part of the issue. It really contributes to this sense that our history or our stories and our past are not important, and it overlooks so much of the violence and injustices that our communities have faced.
Yeah, thank you both so much. So much power in there. Well, we're going to open it up now, so people can use the raise hand function and also, of course, ask questions in the chat, and the students are going to help me pull some of those questions in. So I will open it up now to see if anybody has a question. Because I've got a lot more. Well, I'll go ahead.
There's a question in the chat.
Here we go. So yeah, let's. I'm trying to see if I can paraphrase it. It's a long question. Maybe maybe I can paraphrase it a little bit if you'll allow me. And sorry if I don't do it justice, but I think, of course, it's a purposeful action of over time of the white power structure to set different racial and ethnic groups kind of against each other. And I think this is asking a bit of a question about, what can we do about that, that kind of dynamic and tension that can start to exist between our different racial and ethnic communities. And maybe I would say, what, let you respond to that.
If I think the stereotype of Asians as the model minority has been commonly used to kind of pit groups against each other by using some sort of, Asian exceptionalism argument, when it is really white supremacy that's fueling racism and the marginalization of racial ethnic minority communities. And it can be harmful in so many ways, not just to the Asian community, but to other communities of color. I'm just reminded by something I read the other day by the writer Mei Zhang, who wrote in her opinion piece in the New York Times about fighting oppression. In order to fight oppression, we can't just fight oppression in one's own community, but really everywhere, because anti-Asian racism is anti-Black racism, is anti-Latino racism. And this really important need to kind of recognize how all of our communities are interconnected, because this attempt to kind of use stereotypes or to kind of blame other minority groups for certain conditions or outcomes, or to pit groups against each other, can kind of continue to fuel racism and the marginalization of minority communities.
I think that's a perfect answer, that there's a way that racism distracts you from focusing on where that issue is. We kind of divide it up among different groups, focus on individual kind of responses, but it's really the systematic way, or the systemic ways that racism is manifest.
Mm-hmm.
And the key is not which is greater, which racism is greater in which community. It's just that it may manifest very differently in different communities. It's different because of our histories in the US, because of the social conditions under which we live. And it's a recognition that it's the differences are not how racism affects people, because it systematically affects all of our well-being and all of our health and our mortality. But it just ways in which, how can we look at the way society operates that continues these kinds of discriminatory and harmful biases.
Mm-hmm.
And it's a recognition too that Jane touched upon it, that it's not just society or social or institutions, educational system, whatever. As scholars, we also are guilty of racist behaviors. Just recently, a colleague had a grant review, and one of the reviewers says, well, we shouldn't be supporting this kind of research which focus on discrimination among Asian Americans. We shouldn't be focusing on this kind of issues because discrimination is far greater in Black communities. Now that's a scholar who is on an NIH panel making that kind of discriminatory kinds of statement in the review sheet, and NIH did not see it as problematic. So even among the most, quote, liberal, or the people who are most scientific in their training, are guilty of these kind of systemic biases, and we ought to recognize it and call it out for attention.
Mm-hmm.
And I would advise people from different groups to really study and learn more about the kinds of the histories and the social conditions of all racial groups, so they come to a more comprehensive understanding about how to fight these kind of systemic biases.
Well, I think that's a great point. We were touching upon this also, David, recently. One of a major paper was published in the journal Cell that included a senior author, Kelly Stevens, from our department. along with some of her colleagues, and pointing out the horrible funding discrepancies at NIH for our African American and Black faculty in our field. And it's so deeply rooted. And I wonder, from the perspective of social work, really starting here at UW, what do you think are the priorities? We're trying to figure this out as a College of Engineering, School of Medicine, and in our science and engineering world. We talk about maybe, really focusing on trying to deconstruct our curriculum, address, kind of implicit bias. What perspectives would you have for us as we're trying to, as quickly as we can, address this kind of embedded, deep-rooted racism and bias that really needs, first, the stone has to be overturned. But what actions, maybe, from your perspective, do you find most impactful here now today?
I think that's an important question, given that we are at an academic institution. It's really important to note how, racism, exclusion, and biases affect our students. We've been talking about the model minority myth and other assumptions about who Asians are or who our Asian students are, and other stereotypes, regarding other groups really deeply affect their experiences. So I think to recognize that and do our own learning and education to really integrate anti-racist pedagogy in our curriculum needs to really recognize and grapple with those questions that you're posing, and really attempt to kind of include the experiences and perspectives of those groups and really center those voices, so that we do start to do some learning and unlearning of our own biases, and ensure that that kind of translates into our curricula and the ways that we teach and engage students and approach education.
And I would add that to look at it systematically, from faculty diversity, student diversity, curriculum, and to identify where the low-hanging fruit will be in terms of removing some of the barriers to the more far-reaching ones. I mean, our school itself went through a number of stages, and this year we made a strong commitment to hire more Black tenure-track faculty, and we were successful in doing that. But it really did take a commitment from the dean to the faculty to students to be active in thinking, what are the barriers in recruiting? Are we making a mistake just by hiring one Black tenure-track person a year? Or are there better strategies in looking for more of a pool of candidates who we can hire collectively to slowly begin to develop a community? So kind of systematically thinking through that. It's kind of a chicken or a egg. Do we diversify our student body first, or do we diversify our faculty? But there may be ways to kind of think through, maybe we diversify both at the same time. And then working with students to think about the curricula and where there may be kind of easy changes versus one that may take a little bit more a long-term approach to address the kind of biases. Because, changing the curriculum is one thing, but changing the way faculty are trained to teach that curriculum is another thing too. So.
Well, and I will say, I again, am so grateful to have you both here, but I'm also really hoping that we can create more of a community across our campus and schools, because I think that is a big issue for us in engineers, School of Medicine. We're so, focused on our technical training and technical aspects that we're not that knowledgeable. And, a problem that we've discussed is, how do we change when we don't know how to change? We're not we don't have the scholarship in these areas that underlie change and actions and appropriate, ways of dealing with this, the deep-rooted nature of racism and ethnic issues. We need help from people like you. And I'm really hoping we can connect. And, there's this aspect of it. How do we change the way our faculty think and our curriculum? But there's also, when I hear about Jane's research and I think about ways that, technology to some extent can also help these health inequities. But if we came together, I think more across our campus in this sense, there would be such exciting impacts and new ways of thinking and training the next gen as well. So maybe that's a personal hope of mine.
Oh, no, I just want to say, yeah, I totally echo that, because we really see the value in interdisciplinary scholarship and research. It's so important to learn from each other, because when there's diverse perspectives and opinions, you can do so much more exciting and innovative work. So yeah.
Yeah. But I think we don't often talk about those. Yeah. I was going to say, we don't often talk about that facet, Patrick, that you're talking about, how we look to change the way we do our business. We discuss collaboration and research, sometimes in teaching, but not in terms of how we change the way we normally do things that may actually be better in the long term.
I think
one of the things
that's the way I feel. It's our moment, David.
Yeah,
To get
I agree. Yeah. I mean, even looking at how we think about leaders, if we stick to looking at Asian Americans, one of the stereotypes is good workers, hard workers, smart, nerdy, but not necessarily good leaders. And to the extent that engineering or medicine or social work may actually have that bias, we'll have to explore that. And how do we change that kind of perception in terms of who is a good leader, what makes a good leader?
And I myself just acknowledge, I see so many of these stereotypes in my world, at grant reviews, at promotion reviews, and it's insidious and pervasive, and we got to do something. So we got some questions coming in, and I'll start with one. What can this moment teach us about intersectionality?
Yeah, I mean, I think maybe that question's getting a little bit at what happened in Atlanta. The shootings really underscored how there are these systems that really mutually reinforce the dehumanization of certain groups, really the intersection of not just racism, but sexism, but also classism. So, the shootings in Atlanta, Georgia, it wasn't just a part of this recent surge of anti-Asian violence during COVID-19, but also, part of this long-standing issue of violence against women, against massage workers, against low-income communities. And I think it brought it all to a more public light. And I think I'll be remiss to, not note this, I think the response from the killer and the police, this attempt to rationalize the killings through noting that it was a sex addiction, or the police officer saying he was just having a bad day, I think really exemplified this dehumanization of Asian folks, of women, as well as massage workers and sex workers. So, I think the response, was so infuriating for me, not just at a personal level, because it was just another attempt to really of an individual, but also of systems, to really gaslight our real and lived experiences of racism and sexism and their intersections. So just so important to kind of look at the intersections of different oppressions. And again, kind of how I noted earlier, we really need to kind of note how oppression kind of intersects and is interconnected to other different forms of oppression across different identities.
Yeah. And part of the ways we can look at systemic racism is to disentangle and understand better the heterogeneity within racial ethnic communities, that there is not this monolithic kind of group. And that's true for, Latinx and Black communities, as well as Asian American communities, that we're have differences. And those differences can be appreciated by gender, by ethnicity, by immigration status, and by different SCS levels. And how that plays out in different communities, I think will go far reaching in terms of how we address the kind of systemic factors that kind of curb our life chances and opportunities.
Yeah, thank you. Another question is, how can we take the burden of educating white and privileged folks off of minorities, which is often the way this is turned?
Yeah, I don't know, Jane, if you have a response for that.
I mean, yeah, that's a difficult question because oftentimes we are tasked to kind of do that educating. And I think there is value in kind of being able to speak about our experiences and to learn from each other. But I think one strategy can be to really acknowledge that work and to value and put value on that work, because it does often go to, junior faculty or faculty of color or women, and who are kind of doing a lot of this work to address many of these issues. So I think investing in that is really key, and because that kind of sends a message that it is important and it is valuable, and to also acknowledge the value in white folks and other folks who might not be experiencing some of these issues to get engaged in that work is valuable as well, and can be one way to acknowledge the importance of that work.
I think that sort of relates to one of my pet peeves in discussions with white allies, is that the first order should be to listen. And I think I've been in a number of meetings around racism or anti-Asian or other kinds of discrimination and biases. And white allies are there, and they tend to dominate the conversation. And my peeve is it would be better to listen first before kind of actively participating, and to see where the spaces you can make a big difference in the discussion can be identified for, I think, more active engagement. So that'd be my critique.
Fair enough. Another question, what are some strategies for supporting students and coworkers who experience racial trauma?
Jane, that's your kind of counseling background that may be more appropriate than my sociology.
I think kind of what you just said, David, is important, to really listen and to help students be heard. I think there, especially with everything going on recently, particularly in the Asian and Pacific Islander community, I think we've talked about stereotypes, and there can be instances where we ourselves kind of internalize some of these stereotypes, and it's hard to engage in discussions or to really open up. So I think first is listening, and in social work we talk often about starting where your clients are, and I think that's so key at this point, to really kind of try to be where the person is that you're trying to support, to really understand where they're coming from, and to come with more of an open mind and open ears to support them in whatever way that they want to be supported and feel that they need to be supported. And it could be different for every individual, which is the key point. It's not that every person will want support in the same way or need the same things. We all need different things, and to recognize that is key.
Okay, I think Ayumi has a question that she'll ask on the live Zoom.
Hi. So while we were talking about the intersection of race and sexism and misogyny, earlier you'd mentioned, Dr. Lee, the PAGE Act. And while I think many of us are familiar with the Chinese Exclusion Act, I don't know if as many folks know what the PAGE Act is and how that relates to the Atlanta shooting. Could you speak more to that?
Sure. I'm not a historian by any means, and but it was the PAGE Act kind of emerged from the Chinese Exclusion Act, where there was this kind of presumption that Chinese women were immoral or that they were prostitutes. So it really prevented women from migrating here, and there were these beliefs about just immorality and sexuality and othering of this group. And I think that it just parallels a lot. So a lot of the exclusionary rhetoric that we've been hearing. So I think, you bring up a good point. We need to be more aware and familiar with these policies that can continue to kind of perpetuate a lot of the stereotypes and experiences that we have, especially as Asian women. I don't know, David, if you know more about the act.
No, I think there was a good description and kind of the rationale for that. Now, I would add too, this isn't necessarily about intersectionality, but it kind of speaks to contemporary American policy, even where you have the expression of racism against Asian Americans. I was reading a story in, I think, Washington Post, where the State Department has been systematically denying Asian Americans from working in Asia countries because of potential hidden disloyalties among Asian Americans. So even in an American institution dealing with foreign policy, you have this kind of devious effect of policies based on a stereotype that Asian Americans are this foreigner, disloyal to their country, and loyal to another country. So.
Yeah, I think you bring up a great point. Just, history is so important to kind of understand a lot, to find some explanation and a bit of a better understanding of what's going on, but that doesn't preclude us from looking at what's happening today and how it's not separate from that history, but it's also distinct, and we need to recognize what's going on around us and not just point to history as being at fault and not kind of taking responsibility and action today.
Thank you both.
Thank you, Ayumi. There was a question about your project, I think, David, and why it's so important, to have reporting and to try to document what is going on. Could you say a few words about that?
Sure. I'm part of a national study that is funded by a number of foundations, including the Urban League and the Robert Wood Johnson Foundation. And it looks at how different racial ethnic groups are faring during COVID, including there's a committee on Black Americans, Indigenous Americans, Latinx, and I belong to the group on Asian Americans and Pacific Islanders. And the intent is to see how groups are faring in terms of their economic lives, social conditions, discrimination that they may experience during these times. And one of the reasons it's an important committee is because it's linked to providing some recommendations to Congress. So there's a strong interest in looking at the findings and giving some policy relevance of how Congress and the White House can respond to the needs of different racial and ethnic minority communities. One of the terrific parts of our group, the Asian American Pacific Islanders, is really we have representations from Asian American communities and Pacific Islander communities. They are separate voices within our group, and to provide very different perspectives on how COVID should be studied during this time, and how the communities can have more active voices in terms of making recommendations to Congress. I would say in terms of one of the studies is we're looking at Asian Americans and Pacific Islanders who report hate incidents, and we're doing follow-up studies about what happens to them and the kinds of social and psychological costs discrimination has on their well-being. And some of the initial findings is that 6 to 12 months later after these incidents, people are still suffering from psychological distress based on that. And kind of the shame that they experience by having it, that they put the onus of these incidents on their own individual behavior, because they frequently think that they could have done something to have prevented the incident from happening to them.
Yeah, and just kind of echoing what you're saying, David, I think it's so important to kind of report these incidents so we get a more complete picture of what's happening. You know, it's difficult to track and respond to these incidents if they're not being reported, but just at the same time, also important to acknowledge a lot of the barriers to reporting, because people fear repercussions from reporting, or might even be unsure themselves whether it was a hate crime or incident of racism themselves. So just important to also acknowledge that ambivalence and to identify strategies to reduce those barriers to reporting, because those barriers are very real as well.
And the reporting thing is not necessarily limited to law enforcement, because I think it would be a mistake to see this as a law enforcement kind of activity when reporting. That when we think of it too much as a law enforcement kind of a strategy, we look at it as very limiting, and we don't focus on the kind of systemic factors that may be related to more long-lasting changes that affect why people discriminate against Asians or other racial groups.
I guess it connects, Jane, too, to the health inequity situation that, has been illuminated this year during the COVID pandemic. And could you tell us maybe a little bit about the connections you're seeing there to these health inequities?
I mean, COVID-19 has just really brought to light so many of the inequities that we've known, who's being most impacted, who's disproportionately affected, who's experiencing worse outcomes because of COVID-19, and again, bringing to light a lot of the intersections of it is marginalized communities, and not just due to race, ethnicity, but class, the different households and how different communities live, their societies, access to health services. So it's bringing so much of this to light, and really bringing much more urgency and need to kind of look at these issues structurally, and seeing how all of our communities are connected, and to really address you know, we're seeing COVID-19 to really address COVID-19 in the US. It's not just one community, it's all of our communities that we need to really understand and support.
Yeah, I think the big mistake after, I'm optimistic, after the pandemic ends and we're sort of back to normal, I think the big mistake is to forget about these inequities that have been uncovered by the pandemic. You know, we must keep the spotlight on these inequities, even after the pandemic subsides, and address the factors that have led to these kind of inequities before COVID came about. So.
Yeah, it reminds me, to keep the spotlight and not the gaslight on these issues. So maybe we've got 5 minutes left, and I think, that is a bit of a segue maybe to our final comments that, what can we do to keep the spotlight and not the gaslight coming on here as we reach the end of the pandemic and move forward? None of us know what that really means yet, but in closing, kind of moving forward, how can we all, especially as white people, deconstruct this embedded racism? But it's also that kind of colonial, indoctrination that we need to deconstruct and hear other stories. How can we move forward? I know that's super general, but just maybe a few comments at the end from both of you.
Yeah, I can kind of get started in that. I would say that if you recognize it as systemic, then the responses have to be systemic. Mm-hmm. And that will mean acting and supporting opportunities for different racial ethnic groups. And that would mean supporting housing conditions to be improved, looking at educational kinds of outcomes to enhance those for all racial ethnic groups. And a key thing that all of us actually can do is to vote and support people's rights and opportunities to vote too, because those get at some of the systemic issues that affect why racism has such a huge consequence in American society.
Yeah, I would echo that, David. And I think oftentimes when folks talk about the need to address systemic issues and for structural changes, that can somehow seem like separate from acting individually, but really recognizing that we as individuals are part of these systems and are part of these communities. So to really change the policies and structures does really require us to act and to take action and to seek to address these policies and structures that perpetuate inequities in our society.
Well, I want to thank you both for your voices, for your time, and it's been really special for me to get to know you first here by Zoom and to hear everything you're saying. And I know our whole community really thanks you for this and for all your actions and the associated issues and problems. And I really hope that we can make this systemic as a first step at UW and work together more and use our expertises together to address these huge issues. So thank you. It's been an honor to have you both with us today. And I hope we can continue in the future.
Thank you.
Thank you to all the students so much for everything you've done over the past week and a half. And there's going to be now an optional discussion period I wasn't able to get to all the questions, but hopefully you can maybe bring some of those back up in your discussion period, and so we'll reconvene for that discussion period now. Thank you all for coming on to this Zoom, and please let's take action together going forward.
Bye-bye. Take care.
Bye, David. Bye, Jane. So
Bye.
thank you so much.
Thank
We
you.
couldn't express how much I appreciate everything that you're saying, and it's very inspiring to me personally. Thank you.
Thank you. Bye-bye.
All right. Hi, everyone. Thanks, everyone, for coming. Really appreciate it. And although Dr. Takeuchi and Dr. Lee have now left, just want to reiterate how appreciative we are of them showing up, and especially on such short notice and doing this for us. And, we really look forward to continue working with them to, take active steps forward. For those who don't know me, my name is Evan. I'm a first year in the MolES program. I've had the privilege of helping organize this event with the EI committee. So yeah, we're going to move into the discussion section of the seminar. So the recording is going to end. And